is going, from our tax money, by the way. It's mostly going to defense and social security.
A lot of medical procedures that are available to everyone are so expensive that like a lot of people can't afford to pay for it out of pocket.
But on tier 2, you'd have to pay like a certain small amount. Tier 3, you'd pay the whole amount. And most people can afford tier 3, but tier 1 is still pretty expensive for insurance.
You can go if you get sick, and there's like no one can be like, oh, you don't have enough money or anything. Do you think that we should have something just like that here in the United States?
The amount of people that talk about the right to health care, it's a very small amount of people. And like you said, like a lot of people have suffered from the lack of quality that comes from their health care. The United States of America is about $88 billion in debt. How do you guys think that this relates to the right of health care in America today?
I think that this is an example of how America just uses so much money, and if you look at the statistics of where this money is going, from our tax money, by the way, it's mostly going to defense and social security rather than more important things like healthcare, which I think everyone should have the right to.
Yes, I think the healthcare industry really profits off of putting people into debt. And a really important example of this is med school, because doctors and nurses and other medical practitioners have to incur hundreds of thousands of dollars, up to like $600K, just to be able to learn all the things that they need to do in order to do their job.
I agree. Like the amount of debt that they have, like the student loans that they need to pay back, they don't get enough salary as they should, because like they need to like pay back for their
Yeah, they would pay a lot of money, and then in like another 30 or 40 years, they wouldn't get that much money back or so, and it's not really helpful.
I think it's also very inconsistent. Like a lot of people might not have that kind of money to pay, and if they were to get an accidental incident or crash in their car or break one of their bones or do anything of that matter that might harm them in any way, they wouldn't be able to pay for that kind of stuff because they might not afford it.
And that obviously also decreases the public health. And if we have so many people that are turning down medical services because they know that they can't afford it, how does that reflect how our country can deal with its citizens and make sure that we live in a country that can protect everyone in it?
Yeah, and I think we're really seeing this shortage of medical workers, especially with, past crises like COVID, when hospitals were so overwhelmed with the number of patients that there weren't enough nurses, doctors, and other practitioners available. So people had to remain sick and remain untreated, and some were even left to die because of our shortage of medical practitioners and medical resources.
I agree. Not only like them having to like take care of others, they also need to take care of themselves. For example, what you said about being in COVID, like a lot of like doctors and nurses had to like be careful that they won't get COVID or affect their loved ones when they go home. So it's like a lot of like tensions going on around about like, oh, would I get my family member or loved one sick while treating someone else?
So do you all believe that we have the right to health care? And if we do have the right to health care, how would you guys go on about making sure that we can ensure it in our country?
I do believe that it is technically available to everyone. Anyone, if they wanted to, they would have the right to health care. They would have the right to, having a medical procedure, the right to doing anything of that sort. But without that amount of insurance and that amount of investment that they have to put into the healthcare system, it's just not fair to a lot of people. So on one hand, you do have the vast majority that can pay for it, but on the other hand, there's the other majority that might not be able to, and this could be potentially discluding that population.
For example, a lot of medical procedures that are available to everyone are so expensive that like a lot of people can't afford to pay for it out of pocket. This is why we have things like insurance, which are mostly paid by employers. So if you have people working, minimum wage jobs, like, as a cashier or something like that, you don't have a lot of employment benefits because these are part-time jobs.
Exactly.
So a lot of medical procedures, such as hospital stays, can cost up to $1 million, and even transplants, like organ transplants, can cost up to $850K.
Exactly, and with the tier system and insurance, it doesn't really help because I know my family, we're on tier 1, where insurance covers everything. But on tier 2, you'd have to pay like a certain small amount. Tier 3, you would pay the whole amount. And most people can afford tier 3, but tier 1 is still pretty expensive for insurance.
I agree. I feel like not everyone can, everyone can get the procedure as you said, but they can't afford to pay it. And for example, my dad, when he got into a car accident, though we're middle class people, we can still pay for our medical bills. He just got stitches on his lips. He had to pay up to $30K for the stitches, and for him being in the emergency room for an hour. I don't believe that everyone can pay up to $30K just for an hour. What about if you're have cancer and stuff? Not everyone can afford to pay the bills.
Yeah, and then in addition to that, you see an increase in things like cancer and diseases that are just increasing over time because of a variety of different factors. There's environmental factors. There's also an increase in technology, which has been linked to cancers and tumors, and with an increase in declining health, we can see that with so many people who are getting sick and so many people who need healthcare, and we are denying this right to them because they can't afford it. We see some sort of injustice because you see how much money that we pay as American taxpayers to things like the defense system or to Social Security. And to Social Security, that makes sense, but to the defense system, to how much money we give to our military, we already have the strongest military in the world. While we could be using this money and taking this money to more important things like healthcare that will protect and make sure that every single American citizen is well and is able to have the life, liberty, and pursuit of happiness that is granted to them by the Constitution, which I feel if we are denying them this right, how can we really say that our country is constitutional?
So do you guys think that the government should have some sort of basic insurance plan that available to all citizens?
Yeah, because as we've been saying, poor people won't be able to spend that much money, $30K. They won't be able to spend that much money, and they won't even earn that much in a few weeks or days, and it's not helpful. But on that note, if we do have free healthcare, wouldn't the process and the quality of healthcare go down because it would be free for the doctors?
Well, wouldn't the healthcare pay the doctors the same amount? It would just be available to a wider array of people.
I'm not sure if you guys know about NHS in United Kingdom. So basically, I believe the United States should do something like that. In United Kingdom, there's this basic thing that every citizen or anyone who permanent resident who lives there gets medical stuff.
Insurance.
They don't need to pay anything at all. No matter what, everything they get treated just by the taxes that they pay. So it's not you need to get extra insurance or anything. It's just you can go if you get sick, and there's no one to be oh, you don't have enough money or anything. Do you think that we should have something just like that in here in the United States?
Yeah, I think we talked about that, and I feel some sort of basic plan for healthcare for everyone should be something that the US can work towards. How do you guys think that having a basic healthcare system would affect private insurance and the jobs of people in private insurance?
I do think that along with all of these pros to having the right to healthcare and, you know, kind of using your own taxes to pay for the healthcare you have. But also on the other hand, there's cons to this, like you said, jobs. A lot of people that work in the healthcare system may suffer from maybe less income, less wages due to the lack of people paying their insurance that's due.
Yeah, I think we're seeing this right now with the tech industry, because for an industry that's been, you know, taking in so many employees, now they're starting to let them go by the tens of thousands. And I feel like we might start to see something similar with the healthcare industry and the insurance industry if the US were to instate a basic healthcare program. So we need to do something to mitigate that.
We live in a country where the right to healthcare isn't necessarily stated true in any of our legal documents. So technically, the U.S. the government doesn't have to give citizens the right to healthcare. And also, if you think about it, some people argue, why should people have to be able to get healthcare and be able to get better and not have to worry about paying for things that they put on themselves, especially if they do something that's wrong for their body, and we should instead pay the consequences for them. What do you guys think about that?
Yeah, I do agree. I feel like this topic is also like the amount of dispute on this topic isn't enough. Like the amount of people that talk about the right to healthcare, it's a very small amount of people. And like you said, like a lot of people have suffered from the lack of quality that comes from their healthcare. So why should American citizens be paying these large, hefty prices for their own healthcare and for their own well-being if even the quality isn't as good? Like you said, your dad had stitches.
Got into a car accident.
Yeah. So a lot of these flaws can also come within the system. So I feel like instead of paying these hefty prices that are there for the default procedure or surgery or whatever kind of medical bill there might be, you can pay for the quality of the work that's been done to you in the medical system.
Well, I feel like this is something that's happened, you know, for decades. Like, medical procedures are so insanely expensive that you have to sort of stop and wonder if it's even worth it. Like, does it really cost $30K for a bed in the ER and some stitches? Is it really costing hospitals that much?
Yeah.
And also, I think we need to keep in mind that hospitals are not just, you know, charity banks. They're not food banks. They don't provide services for free. That hospitals are also, like, at the end of the day, they're businesses. And they do need, you know, money to survive, and money, any sort of business needs some sort of profit margin just to keep them running. However, I feel like just the sheer extent of how expensive these are, like, you know, $1 million for a 2-week stay in a hospital, $800,000 for a liver transplant, like, it's so much, and it's really hard to put a price on, you know, life, because that's what healthcare ultimately gives us.
Yeah.
But at the end of the day, it's too much.
Yeah, I do agree. New York Times actually put out an article based off of like something related to this topic. It was about like the large like fluctuations on either side, like either hospitals are getting a lot of money, or on the other hand, customers or people who need insurance aren't paying the more higher prices that they need to be paying. And I feel like these like contrasts between the two of them are really part of the problem, because if we're going to talk and discuss about the amount of money being put into the healthcare system and the amount of money that's being taken out of our accounts, then we need to put into account of these like improper like distributions between the two categories. So I feel like when disputing this topic, we need to discuss more about having a more even playing field and being considerate of people's jobs as well as the people who are getting hurt and potentially their lives are at risk.
Yeah, I feel like one way that we can maybe, you know, work towards solving that is to offer an array of like prices for servicing based on people's jobs, their income levels, you know, like other things like that. So if you make maybe say $30K a year, you know, you can get financial aid in hospitals. If we can do it for college, we can do it for hospitals, which is when one is, you know, vastly more important than the other. Even personalizing insurance bills, like if you're a healthy person that goes to the doctor maybe, you know, 2-3 times a year, you should not be paying as much as someone who has a chronic illness and needs medical attention, you know, maybe monthly.
So what we can take from this is, yes, it's obviously insane that someone has to pay $30,000 for stitches, or that women have to pay thousands of dollars just to go through labor in a hospital. Like you said, your solution to make sure that everyone pays the amount of money that they should, depending on how much they make and their income and a variety of other factors. I think that would be the best way to solve this problem and to make sure that everyone can be in good health in our country, and making sure that we aren't also denying the individuality of hospitals and being separate from government.
How do we influence this though? Because even if we're talking here, how would this get out and help others, you know?
Social media is like really powerful, you know. Email your senators, your governors, I don't know,
And I feel like even just like
pursue careers in policy, stuff like that. You know, always helps.
And just like more young people like this, like we consider this topic to be important enough to talk about. So young people like this pay more attention to these large controversial topics, and more people start to talk about it, it becomes more of a bigger issue that can be considered on a higher level.
You know, young people like us, we're the future of this country, and we need to be the ones, you know, writing the law books. So I feel like if we, you know, really think about this topic and are really passionate about it, there's definitely a way that we can carry on with it in the future.
I agree.